I'm more than happy to see you all and to wish you a warm welcome to this Global Community Health Workshop. I'm not able to say it in the other language, but I have very good friends and they helped me to find a way to have a good translation on my slides. As you know, this Global Community Health Workshop is co-organized by the International Union for Health Promotion and Education, the School of Public Health, and the UNESCO chair. And I just would like to tell you and to remind you, perhaps for those who were there last year, that the spirit of this workshop is to bring together and share knowledge and experience and to shed light on our challenges, experiences from multiple perspectives. The idea is to be both, I would say, concrete, operational, what to do tomorrow, and also to enrich our views through different perspectives from the different cultures, the different countries, and also from the data from research. And I just would like to share two ideas with you: the roadmap and the tools we have. Concerning the roadmap, and it's a kind of a, I would say, introduction for the different talks of this workshop, to tell you that this roadmap, for me, from my point of view, and the one of the UNESCO chair, is made of three components. And I would like to invite you to think of all the different lectures, talks, voice from the field, and exchange through these three different key ideas that shapes the roadmap. The first one is, of course, the ethical framework, our vision. And you know what? In community health, the vision is the trust in the people's capacity to contribute to their health and theirs of the community. So when all things we're going to share today are based on this vision that people are capable, they are not only the problem, but they are part of the solution. And as we often say, nothing for the people without the people. And yes, our vision is based on empowerment, based on values like solidarity, respect, but with this idea of the capacity of the people in their contribution to their health. The second idea of the roadmap is the fact that you cannot build any resilient community without creating the conditions for a real, genuine dialogue between the different kind of knowledge we have from the policymakers, from the professionals, from the researchers, and from the people themselves, because they are the ones who are creating health where they are. So the second part of the roadmap is the fact that we always need to have all this knowledge in dialogue. And the last one is, of course, to develop strategies for social change, to make concrete change in the organization of our communities. So this roadmap, it is just to have in mind that moving forward to build healthy and resilient communities, this is having a vision, the trust in the people, having in mind that we need to share and to put together different knowledge and to organize that through a strategy for social change. So this is the roadmap. Now, what about the toolbox? What do we have in our hands to do that? Of course, the first tool we have is the capacity we have to influence the environment in which people live. This is physical, the social environment. This is also the development of the capacities of individual and population through education. And this is the access to the preventive service, to the prophylactic services, like, of course, a vaccination test and everything. So we have a roadmap and we have a toolbox: environment, development of the capacities, and access to service. And I think this is something which is common to all the different talks we're going to hear during these 3 days. And I think that what is important is also to say a word about the community. Our community, this is, of course, our family, the people with whom we are living. This is the neighbor. This is our clans, tribes, our organizations. But this is, of course, also all the living beings, animals, plants that share our lives, and also the planet. You know, this very small oasis in the universe. And building healthy and resilient community, this is a common endeavor for all of us. And I really, really, really welcome you to this workshop. And I wish you 3 fantastic days of learning and sharing. Thank you very much.